So my name is Chris Masila, Dr. Chris Masila. I'm a public health expert. I run my own public health consultancy firm called PractHealth Consulting for the last 5 years. And basically we work with public and also private sector in Kenya and also in Africa and globally on different subjects when it comes to public health. So public health issues ranging from health system strengthening, building commercial health businesses, product entry, and working with also various development partners so that we're able to provide universal health coverage to all Kenyans and also globally. So I'm passionate about public health and also trying to ensure that it is affordable and innovative and also basically fulfills in terms of last mile delivery. COVID-19 is a basically respiratory virus, and it's amongst the coronaviruses which have been famous. Even a normal flu is basically a coronavirus. Yes, so it's a simple virus but very deadly, and basically it spreads through basically simple coughing. So once you cough, you basically release droplets into the air. And these droplets, sometimes they stay for some time. And if you're very close to that person, you get infected with this COVID. So basically the simple signs and symptoms for this COVID-19 are things like fever. Sometimes you have a cough, dry cough. Sometimes you have big high temperature, some aches, nasal, running nose, sore throats, and all that. So basically, those are some of the basic symptoms we see in Kenya and also globally. I would say it's quite high risk in terms of getting COVID when you're exposed in a really confined area. And the idea is to ensure that we ensure that the spaces are very safe and also healthy. And we employ some of the key measures that have been provided by various organizations, including the Ministry of Health. So I would say, yes, there's a high risk in terms of getting COVID, but this risk can be eliminated or reduced by using various measures. Of risk assessment for COVID or any other public health outbreak or disease, when you're in a workplace, I think this is important and mandatory in order to protect your workers and also the people who come in, your clients, customers, and all that. So doing a simple risk assessment can be done internally by the management team by basically what organizations do is assign, let's say, a risk officer or someone who can really take, who is responsible for compliance issues. So assigning one member of your team who has maybe previously been trained or can be trained and on the basically risk management process when it comes to risk assessment. So I think critical is to have within your team, allocate someone who will really manage some of that. There are guidelines which have been provided by the Occupational Health and Safety Directorate within Kenya, the ministry, and also other organizations. So in terms of doing more in-depth risk assessments, you might want to invite an external expert. For instance, sometimes you invite engineers who are trained in occupational health and safety, or even infection prevention officers who can just come and survey your workplace and ensure that you're complying to a number of, they have usually a checklist and they look at various things from planning, organization, how you're eliminating the risk, and just tackling the basic COVID-19 challenges when it comes to spread. So I think implementing a workplace risk assessment is very important for organization, and it helps in terms of making you plan for future in terms of managing the risk in case you have a COVID-19 patient or someone who contracts it while in the office. You have various procedures or laid down procedures that can be able to handle that. It's basically trying to identify the potential for accident and emergency situations and address based on this COVID-19 pandemic. So I think just identifying what are the scenarios when any accidents or emergencies happen. For instance, you have a COVID patient or someone starts heavily coughing or that kind of thing. So I think that is something we need to identify. The other thing is also provide training and relevant training to your workers, uh, from the reception to the people working in the space, or even your clients. Sometimes it's good to share information, either digitally or even within the space. You can hang posters and that kind of thing. So I think that information sharing is important, and telling them in terms of emergencies what will happen and that kind of thing. The other thing is also having some first aid kit within the space in case of any person getting sick or needing medical assistance. So I think that's something we need to have, and well laid down procedures. The other thing I think good in your risk assessment is to assess how, in case of an emergency, who are the first responders, who will the person call. So have the numbers well displayed out, so that in case of any emergency, someone can quickly call or the person who is in the space at that time. The other thing is also just to note down some of the key risks. You might want to really classify them as high risk, medium risk, or basically low risk. So you create a risk management plan as part of your management team, and you assign people who, in case of anything, can respond. So I would say those are some of the key aspects when you talk about risk assessment. And definitely this in terms of getting experts, especially the occupational safety and health experts. We call them OHS sometimes, or OSH experts. And they're very good in terms of trying to work with you on this. So it's key basically to look at policy issues, planning, organizing, how you'll implement, then constantly reevaluate your risks, because it's not a one-off exercise, and you need to evaluate and seek any actions for improvement. So it's a continuous exercise, and the management team within the organization or within the workspace need to regularly review some of this information and assessment. For employers and business owners, based on the socioeconomic situation and the employees need to earn money, they need to really think about reopening. And this has to be done in a transition way, like gradual resumption of activities. So I think first is to really identify what are some of the key essential workers or services who need to come back to the work and work from your space. That's number one. Number two is basically encourage also, I think with COVID now we are moving towards teleworking. There's a lot of remote working. Before, I think people never had to come to the office. But I think now with COVID, the last, I think 4 months, even with my team and many other organizations, many people prefer just to join, let's say, a Zoom call like now, or Skype and all that. So I think it has become really good. So try and manage that and have in shifts within the workplace, so that you don't have many people crowding into the space, especially if it's a small space. The other thing is also trying to also think about how your workplace will be laid out very well. Like I like how Ikigai has really done well when it comes to placing posters, even where someone has to stand or where you're sitting, they're placed and has to be cleaned regularly. So I think some of those small changes to your workplace will be great to really ensure that there is regular cleaning, there is proper layout, there's not so much overcrowding. And of course, they have to stock PPEs. PPEs, the preventive equipment, so that you ensure you have alcohol-based rubs wherever, sanitizers, and different things in terms of doing that. The other thing is train your workers on basics of COVID. I mean, they need to know. I mean, when someone is entering your space and you're using a thermogun to check their temperature, if they're above 37.5, what is prescribed, you should just tell them to go back home or just come another time. So I think trying to sensitize your workers and staff about people who are coming into your space. The other thing is also just to continuously monitor what is happening. So I think that's key in terms of continuous updates. I think this COVID-19 is going to be with us here for the next couple of years, because currently globally, I was checking today, almost 25 million cases have been affected as of today, and almost over 800,000 deaths. In Kenya, we have over 500 deaths. So I think it's still with us, so we need to still monitor the situation and continuously, gradually open. Number one, I think the WHO and the Ministry of Health here in Kenya emphasize, wash your hands with soap and water if you can. The space needs to provide that within the working space. So ensure that you're washing your hands with soap and water, whether you're within the spaces, to ensure that you're complying with that. So simple 20 seconds and showing the guidelines how you wash. So don't rush in washing your hands. Number two is basically having respiratory etiquette. Please cough with your elbow like this. Don't just cough in the air like that carelessly. So use your hand like this in case you're coughing a lot or you have a dry or wet cough. So simple measures like that. Thirdly is also because COVID is a respiratory disease or virus, and when you release droplets in the air, sometimes they go very far. So that's why the agencies are recommending for social or physical distance. I know social has now transitioned physical because people were saying social, people will stay alone and all that. So there's a lot of emphasis on physical distance, and the recommended is either 1 to 1.5 meters between yourself and the next person. The other thing is also avoid touching your face a lot. So don't touch of course you can't touch, you have to touch something, like now I'm touching the desk. So try and limit a lot of touch, and if you're touching something, please sanitize before you move to the next next activity you're doing. So please avoid touching your face and that thing. The other thing is also monitor your temperature. So in a workspace, when someone is entering, let's say through the gate or through the office, make sure the watchmen or soldiers within the building basically have a thermogun, and they check that the person is not above that 7.5 degrees. The other thing, if you're not feeling well and you have some of these symptoms, please stay at home. You can work from home. So, and also contact the nearest facility. The Ministry of Health has given an emergency contact number, 719 in Kenya. So in case of anything, and I'm sure within the workspaces, they have their own emergency protocol. No handshakes, do not shake, no hugs, face masks. And this is not N95 masks, which are very specialized respiratory masks. So simple face masks, which are surgical masks. Some people use fabric masks, and ensure that they have 3 layers, and ensure you're wearing the right way. Sometimes people wear the wrong way. Like right now I have a surgical mask. So it's key to ensure that you wear from the strings and you put it at the right direction. So avoid basically touching the mask outside or whatever, just touch on the strings to avoid proper infection control. So those are some of the simple measures that you can apply in your workplace, wherever you are. I think it's mandatory for employers and offices, especially the employees, employers, to provide PPEs. PPEs, many people might not know the full meaning. PPE is personal protective equipment. And basically it includes anything from surgical masks, respirators, gloves, gowns, boots, and all that. I think something which prevents, let's say, a virus or disease from penetrating your body. So it gives you some protection, either from all the orifices, from the face, the mouth, the nose, and all that. So I think this is very key. And employers are obligated, I think, by law and also by some of these international regulations to provide their workers with PPEs needed to keep them safe while performing their jobs. I think it's key. Simple, at least provide soap and water. I think that is basic. Number two, also provide, if possible, alcohol-based rubs, so sanitizers within strategic points within the location. So I think that will be key. The other thing is, if possible, you can provide masks. Some provide each worker like a box or a pack of 10, so that they're able not to all the time buy masks. So I think it's cheaper and makes the workers also really feel comfortable when they work in the space. The reception, sometimes people put pyric glass, a special glass where when someone is talking, because the reception you're always receiving people, sometimes people put a special glass which has to avoid the droplets going up there. So I think, and also some people even wear the face visors. You've seen people not using this mask, but they have something big, especially in restaurants, because they deal with food, and so they're a bit very careful, and even in supermarkets. So I think it's upon the organization to really take care of their people, especially when they're working, so that you don't avoid, you avoid a spread within that space. Measures are still the same: wash your hands, social distance, respiratory etiquette, ventilation, proper ventilation, ensuring there's adequate PPE, sanitizers, and all that. So what I've mentioned before still, but for high-risk jobs, this is where, for instance, if you're working in a busy restaurant, busy banking hall, even in a hospital, you're receiving a lot of patients, a laboratory where there's a lot of testing, you need to have more measures. So maybe that's what I was saying, maybe having the physical glasses or Pyrex glass to avoid a lot of droplets. You can also wear maybe face visors instead of, beyond the masks just wearing, you can also add a face visor. You can also increase the number of sanitization points, have more sanitizers in the space. There's also a lot of, maybe add physical barriers if possible. Also encourage a lot of teleworking if possible. So not everyone needs to come to the office. So encourage a lot of shifts, teleworking, and that kind of thing. So I think it's important for you to identify, we talked about risk assessment. So when you analyze your risk, you can grade yourself. If there are places where it's high risk, I would say if it becomes very untenable, maybe you can close that space and ensure that maybe later on people can do that. I think I've seen, let's say, government offices or even other private offices, some have closed for the last, in 6 months, because they know that once they open up, everyone will come to that space. So I think those are some of the things you can take and monitor regularly what is happening in the space, and also employ more measures as possible. I think it is an important step. So physical distance is basically where you keep a distance from yourself, from the other people, at least 1 to 2 meters as is recommended. I think some of the things which can ensure this is observed, and I think I've seen in many spaces, is having posters. Some people put where you stand to the next person. There's a poster which is there on the ground, so that it encourages that you always are looking at the poster. The other thing I've seen is in the workspaces, basically how people are seated. You remove some seats within the workspace and have very few seats. That's the other thing. For instance, if you're having a meeting like where we are, so you have like a recommendation, only 2 or 4 people needs to sit there. The other thing is also clearly laying out the workspace. So the directional, multi-directional. So people don't move the same way. So you have a clear layout of how people are moving. So basically modifying the workspace flow. The other thing is also limiting a lot of access to the public. I think only members but if you're a restaurant or a hotel, it's difficult, but I think limiting access to the public is key. So to avoid crowding. Of course, use of signs and posters, I think is key, where you stand, where you sit and all that. So I think I just want to echo that even if you're wearing a mask, you still need to try to maintain physical distancing. So I think combining masks and physical distancing, very important. In Kenya, I think as of last month, we opened our airspace locally and also internationally. So someone can come in and to Kenya and also travel out. So I think as a business traveler, first, I think the country you are traveling to, you need to check online or asking through the embassies, what are the requirements? Because for instance, for myself, I wanted to travel, I have work in Burundi like 3 weeks ago, but they told me I cannot travel because once you travel there, you land, you're on a forced 2 weeks quarantine. The second thing is maybe have a COVID test done. So they encourage you to have a COVID test and you have a COVID kind of a certificate saying that, let's say you're COVID negative, so you can travel with that pass, and you can travel with it different countries. I know the East African community has developed like a digital way. There are a number of innovations that have come up during this COVID-19. I mean, people even have like a bracelet where it monitors your temperature and all that. And when you land, I think in Japan, they have developed a digital AI system where they have a tag. When you land, you just tap on it, and it can tell you if your temperature is high, you're negative, and you're allowed to pass. So some countries have even gone very high tech. For instance, in Kenya, when you travel, like even local travel, they tell you to fill a form and say what symptoms you have, whatever, if you're okay, then you deposit that form when you're departing. So I think that's good when it comes to contact tracing, because we are losing a lot of contacts. When someone is positive, you don't know who he has interacted with. So I think that is key in terms of business travel. Also read some of the international guidelines. WHO has given a lot of guidelines. The Ministries of Health have, CDC and many other organizations. So there's a lot of guidance on business travel and all that. The other thing is also to ensure you practice the same aspects when you're traveling. Wash your hands, because you're always touching many things when you're in the plane, in the airports and all that. Limit the touch points. Wear your mask in the airplane. I know the airplanes now, they say they have kind of trying to adjust the ventilation systems so that the air does not really circulate heavily, especially if there's any exposure. So I think still wear your mask the whole period. Just practice the same measures, physical distance where possible. If it happens, quite unfortunate, but do not panic. People should not run away. So number one, I think, and it might happen, of course, with COVID, with the cases and the testing that is happening. So you might get exposed. So it's key to quickly isolate that person, either the worker or the customer or the person working in that space, and identify a separate room and ensure that it's a separate room and also it's closed, number one. And also try and also open the window when that person is placed into that room so that you provide adequate ventilation. The second thing is also, if the person does not have a mask, please have a mask provided to him. So that's why it's key for spaces to even have spare masks within their stores or whatever, in case someone gets sick and someone is handling the person or giving first aid. So provide them with a surgical mask for the affected person. Limit the interactions and really cordon that area to access to anyone. And also anyone who's providing assistance to this person, let's say he needs to be resuscitated or needs to be attended or given some medicines to lower the fever, that kind of thing, should wear a mask, even gloves sometimes, and even sometimes they advise even goggles sometimes. So basically it's because COVID enters into the orifices. So you have to provide these things. The other thing is also clean the areas that have been, once this affected worker is maybe picked up by an ambulance or that kind of thing, clean, disinfect the whole area. Even maybe for that day, you can call the guys who disinfect with the right detergents to really fumigate the offices or that kind of thing. So give it time. So I think that would be key to do. The other thing is just to inform the management of the building or wherever offices you are. You can inform the top management and also circulate some information about this. Inform everyone within the space and make whoever was in the space or within that community so that they're aware and also take precaution. Finally, I think it's important to identify close contacts. So inform them at least immediately or up to 2 days once the symptoms start, and ensure that they seek treatment and at least they stay out for 14 days as per the requirement. Report this to the authorities if need be, that the person is receiving treatment and gets tested. And once they are cured, it's important that they get tested so that they know they're negative, so that when they come back, they don't really infect people. So I think those are some of the steps which you can take in your space in case you have a COVID-19 case. Very important question. A lot of COVID-19 has, I would say, affected a lot of psychology in terms of because of loss of job, lost productivity, people losing jobs, even the whole COVID-19, if you have predisposing diseases and that kind of thing. So there's a lot of psychosocial risk management required. So you need to assess your workers' mental health and ensure that you are supporting them, because I think it's a difficult time for everyone and we need to really be supportive to each other. So COVID-19 has really tested your resilience. So I think it's important to just give positive vibes, out there to reduce the stress and anxiety. Even sometimes offer online support, coaching sessions to allow workers to have confidence in themselves, maintain contact and keep them motivated. Also keep them updated of the information that is coming out. There's a lot of, they call it infodemic. There are so many people talking about incorrect information about COVID-19. So do not rely a lot on social media. Rely on very trusted sources of this COVID-19. So Ministry of Health, some of the briefs, WHO, CDC, Africa Union, etc. Even your local public, private health physician. There's a lot of false information out there. So you need to be very careful because it increases a lot of anxiety in the population. Communicate regularly on the state of your company. Right now, many companies are collapsing. So do not one day send an email saying the company is closed, everyone is fired. So I think it's important to communicate this very carefully and you focus more on the solutions rather than too many problems. I know it's tough for everyone. For the organization or workplace to really look at some of the guidelines that have been issued by the national government, that's the National Ministry of Health. Some people also go to the global references, so you have the World Health Organization or even ILO, International Labour Office, has issued a number of guidelines when it comes to guidance. And some of this is available online on the web, and you can quickly download some of these documents. So the national guidelines and also the international guidelines reference would be useful as a starting point to ensure you abide to some of those guidelines.